Hi guys, this is me Gayatri Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about 22nd of October 22 OET exam, in which I would like to discuss with you all about OET writing. I know it is a late update about the exam, and we all know that we got the information from the OET that the question paper was leaked, and which is really a horrible thing for the people who are prepared for their exam, which is really bad thing. Anyhow, let's things not to happen in the future. We'll try our level best. So what was the letter? The letter was like transfer letter. The patient was admitted in the hospital because of the leg ulcer, because the same scenario we have, the same kind of a case notes. Quite few months ago we got the same kind of the case note for our OET exam. Like the patient got a leg ulcer, so the patient got admitted in the hospital and they have treated for the leg ulcer. Now the patient is, after getting the discharge from the hospital, the patient is transferred to the nursing home, because the nursing home is which is nearby patient's daughter's home. So thereby the patient is completely transferred to the nursing home. So what purpose and what is the kind of case note, and I got only a little information from my students, and anyhow I'll just share with you all. I hope this information will help you to prepare for your next exam. Okay, so regarding the patient, like I'm not sure with the patient name, but it was a referral letter. Actually, patient was diagnosed with venous ulcer in the right leg, and the patient is a female patient. She lives alone and she had a varicose vein, diabetes mellitus, high cholesterol since 2014, 2016 and 2019 respectively, and she is on medications for the same. She smokes excessive. She smokes in excess, and also she's planning to get discharged from the hospital, and she is going to the nursing home where the home is near to her daughter's house. Okay, so this is all about her conditions, and also patient is overweight with a BMI of 29. So now we are writing this letter with this informations, like we are just writing a letter to the nursing home manager for the admission purpose, because the nursing home which is located near to her daughter's house, so which is handy for her to visit her mother, and also that she will be also better that somebody is near with her. So this is about the transfer letter. So as usual, to write the letter we need a date of writing the letter. So today's date they have given, like the date of admission was Jan 8 2022, and when the patient is going to transfer, which means it's 14th of Jan 2022. So which means that what date he have given in the case note as a today's date, that date we have to write it in the top of the paper. And next week, like writing the address. So who is the recipient of the letter, we have to write the address of that person after the date. Then after the date, after the address we are writing the salutations, like dear sir or madam, if they have given the name, that you are writing the surname of the patient. And then coming to the point of reference, so in the reference you are writing the patient full name, as well as that if they have given the date of birth, you can write a date of birth, or else if they given the age of the patient, you can write the age of the patient. Now coming to the point of introduction, so introductions you can write, if the letter is like for the transfer letter, like we are transferring the patient to the nursing home, which means a full term nursing care, right? So what is the patient diagnosis? I said it is a venous ulcer, right leg venous ulcer. So we can just you can write, I am writing to transfer, like that you can start, or else you can start with the patient name, who has been diagnosed with, or else who is diagnosed with a venous right leg venous ulcer, and full stop you are keeping, and she requires a full term nursing care. She requires your full term nursing care and further supports. So that is more than enough, because when we are writing a letter to a nursing homes, there they are expecting like what kind of the care they can expect. It is a full term nursing care. If it is a permanent, it's a long term care. If it is the just respite care, which means they need a short term nursing care, but it is a 24 hours nursing care services can be provided from the nursing home. So this can be written in our introduction. Now coming to the point of present medical history. So what is the patient condition, when the patient got admitted, with what are the signs and symptoms, and what treatment we have provided. So of course for the venous ulcer, like patient got admitted on 8th of Jan and was diagnosed with the above mentioned condition. She has received of course the wound dressing as well as the antibiotics, and also she was provided with some exercise programs, and they have advised her to wear compression stockings. So these all are things has been given for the patient when they were in the hospital. Okay, when she was in the hospital. So these things has to be written in our present medical history paragraph. Now coming to the point of social background, how she is living alone and she smokes in excess, and also she is overweight with a BMI of 29. So these are all things that must be informed to the nursing home people, because these things are very important for them to treat, because overweight is one of the main reason for the ulcer. And also patient is having the known case of, patient is also having what, patient is having varicose vein, and also patient is diabetes and high cholesterol. These all things has to be written in the social background. So we can write, we can start with the name socially. Miss X, like Miss X is like lives alone and has had varicose vein, diabetes mellitus, high cholesterol since 2014, 2016 and 2019 respectively. Therefore she is on the medication for the same, full stop. And then you can write regrettably she smokes in excess and also overweight with the BMI of 29. So now these are the things has to be written in our social background. Now coming to the point of your present discharge advice, which means it's a recommendation paragraph, what they can do for our patients once the patient gone to the nursing home. So the first main thing is like wound care management. So they have to clean them ulcer and they have to rest properly and observe the signs of observe the wound for signs of infections. And second thing is they have to advise her to continue, or else encourage her to continue the exercise programs to reduce their body weight, and the compression stockings for the varicose vein to enhance the blood circulation, and also the diet advice. So they have to provide a proper diet, because she is a diabetes, high cholesterol, right? So they have to give the low salt, low fat, low cholesterol, low salt, low fat, along with the diabetic diet, sugar free diet. They have to provide it for her. So these are the recommendation things that we have to write it for them. So how we can write? So in view of the above, you can write it like that, or else upon transfer, like that you can start. So it would be greatly appreciated if you could clean the ulcer and provide dressing and watch for the signs of infection. Second thing is, and you can write, it is highly appreciated, it would be highly appreciated if you could encourage her to continue the exercise programs. Next thing is, most importantly, she has to wear compression stockings to enhance the blood circulations. And the last thing is, kindly observe her oral intake, especially that she needs to follow what, low fat, low cholesterol and sugar free diet she has to follow. So these are the things has to be written in our recommendation paragraph. Now coming to the point of conclusion, please contact me for further details. Then if they have given the nursing home manager name, you can write it yours sincerely. If they not given, you can write it yours faithfully. Okay, so this is the way we have to write a letter. It's a simple transfer letter. The patient is going to the nursing home. So, and also you can mention in the social background, her daughter is living nearby your nursing home, so the patient plans to transfer to your nursing home. Either you can write it in the social background, or you can write it in the discharge advice. So this is a very simple letter. So as usual, introduction. To write an introduction, we need three things. One is patient full name, second one is purpose, for what purpose you are referring the patient to the nursing home, and the third thing is like patient diagnosis. So patient diagnosis is here a right leg venous ulcer. So the purpose, either you can write patient's daughters lives nearby your homes, thereby patient is transferred to your house, like that you can write. Instead of that, you can write patient requires she requires a full-term nursing care from your side, like that you can request your full-term nursing care and further supports. That's also is fine to write. And coming to the point of present medical history, so when she got admitted to the hospital and what reason and what management that we have given, what kind of the conservative treatment she received from us in the hospital, this all things has to be written in the concise and the clarity manner. And coming to the point of social background, she lives alone and she has had high cholesterol and varicose vein, and also she has diabetes and she is taking medications for the same. And another thing is she smokes in excess, and also she is overweight with the body mass index of 29. So this thing we have to write, and we can write, please note her daughter is living nearby your nursing home, therefore the patient will be transferred to your nursing home on 14th of Jan 2022, like that you can write it in the social background. Now recommendation paragraph, they have to provide proper wound care management and watch for signs of any infection. Second thing, they have to encourage her to continue the exercise programs to reduce the overweight of hers. And then third thing is they have to continue the compression stockings to enhance the blood circulation due to the varicose vein. And the last final thing is like they have to provide the proper diet with the proper menu plan to control her diabetes as well as the high cholesterol level, apart from that to reduce her overweight. So these all are the simple informations. With that, be able to write a letter in a very good way. So I hope you all have done in a good way. Anyhow, hope for the best result. And I wish you for the students whomever is going to appearing for your next exam. So do your best and write a letter in a very good way. Read the writing task and what kind of the letter to whom we are writing. So these informations are important to them or not. So just in the 5 minutes of reading the letter, please think and also just remember that what kind of the information is important for the receiver of the letter. So everything is based on the receiver of the letter. Either they want to know this information or not. Either I am writing a relevant or irrelevant information or not. So these things we have to in the 5 minutes of reading the writing letter, that time itself we have to just think it and we have to wisely write the letter. Okay. So see you all in another video with another exam updation, and whomever wants to join in our class, you can contact us at any time. So our number has given in our description. We have a crash course and we have a beginners classes, and also we have a 40 days, 30 days, 50 days classes, and also for separate modules also we have classes for the students. So whomever wants to join in our class, we can contact us, and until then, bye bye.